Dr. Isaac Bogoch. He's joining us from Toronto, Canada. He is an infectious disease specialist. It's good to have you here. And I think some of us who have relatives in Canada know that those of us in the States tend to be myopic and only think of things that happen south of the Canadian border, which remains closed to both sides. But when you look at how Canada's responded and then how we're responding with rallies being held during this presidential election, what's the conventional wisdom? What are Canadians talking about when they see these kinds of things here?
Well, certainly our approach hasn't been perfect, but I think it's been free of politicization. COVID hasn't been a partisan issue. Most political leaders, in fact, at this point of the game, all political leaders have really taken this seriously. In general, we are listening to public health advice, and we're doing okay. It's not perfect, but we're doing okay. It's not an our country versus your country type of scenario, but when we do look south, we certainly are a little bit surprised to see the degree of, shall we say, roadblocks that people are putting up, where you have clear, smart plans forward, clear global lessons that have been learned, yet some people choose not to heed those lessons. So it is a little bit surprising to see.
Hey, Dr. Toronto, what are just some of the most concerning roadblocks, I guess, from your view, just because we do have a president right now who most recently said that the U.S. is actually rounding a corner when it comes to COVID, despite the surge that we've seen in the number of cases. So I'm just curious just about how those roadblocks do you think would further complicate our future response to this pandemic?
Well, in all fairness, there's clear metrics of success, right? There's certain things that we know we can do to really improve a country's response to this virus. One is to have good communication that's grounded in science. And certainly, if we look everywhere in the world, the United States included, we certainly see varying degrees of that. And quite frankly, when you have the leader of state, discussing certain topics that might not really be grounded in science, it can be very challenging. We certainly know that masks have a role, but for some reason, this is still an issue in many parts of the United States, whereas it's less of an issue elsewhere. There certainly seems to be some disconnect between how to get the infection under control at community levels to really improve care and keep numbers low in the communities such that you can prevent hospitalization and death. And there seems to be some struggles in the United States with regards to how to do that effectively. So, I mean, it's tough. And as you pointed out earlier, you're getting somewhere close to 100,000 new cases per day. That's got to be very, very challenging. And I think other countries have certainly had challenges, but perhaps it hasn't been a partisan issue in other countries as much as it has been in the United States.
And yet it's something like, I think it's 66, almost 70% of the Canadian population lives within 70 miles of the US border. And we know that trade is still going on, but the ability of people to come to the United States from Canada and shop and for cross-border flows, it doesn't exist right now. Do the Canadian health officials, have they been in discussions about when this border does open up, or will it only open up when there's a vaccine?
Oh, this is a huge issue here. And I think we're feeling it north of the border more than you might be feeling it south of the border. And certainly this occupies a lot of the discussions that we're having. There's pilot projects now to really what we would look at decreasing the time that people need to quarantine when traveling from international countries into Canada. So currently, if you come into Canada from anywhere in the world, you have to quarantine for a period of 14 days. We know how important travel and trade are. And certainly there's steps being taken to see if we can shorten that by integrating diagnostic testing. So these pilot programs are springing up, but we don't yet have a national strategy yet. We're waiting for the results of these pilot programs. I should still say that essential travel is occurring. So there's about 25,000 people per day coming into Canada. And, a lot of this is our Canadians traveling back to Canada, but certainly the border is open to trucks and trains and people bringing in essential goods and services. But having said that, the travel over the US-Canada border is just drop in the bucket as to what it was before COVID.
Doctor, if nothing changes at this point and we see President Trump reelected tomorrow here in the U.S. and the approach from the Trump administration does not change, how much worse do you think the outbreak could get here in the U.S.?
It's tough because certainly when you have an approach like the one you see now, where you're not really integrating scientific data into the pandemic response, you do see high rates of community transmission. And sadly, this translates into hospitalizations and deaths. I think there still is a light at the end of the tunnel, regardless of who occupies your presidency. We know that there are vaccines that are coming through the pipeline. We know that, some of them are going to fail, but some of them are going to be successful. And the tremendous resources that the United States has certainly allowed that country to really have access to a lot of these. So I think we're going to see some widespread vaccine rollout in the United States, probably sooner than most countries will see that. And I think that will at least allow people to sort of slide back towards normalcy and also help save thousands and thousands of lives.